was told I might be on the autism spectrum, and honestly, I don't know where to start. Let's take one step at a time. First, would it help if we talk about what autism actually is? Yes, please. Autism, also called Autism Spectrum Disorder or ASD, is a neurodevelopmental condition. That means the brain processes information differently. It affects how someone experiences the world, things like communications, social interactions, and sensory input. So it's not a mental illness? That's right. It's not a disease or something that needs to be cured. It's a different way of thinking and experiencing life. People with autism have strengths and challenges, just like everyone else. Okay, do we know what causes it? There isn't one single cause. Research suggests that genetics plays a big role. Environmental factors during early brain development may also contribute. But it's important to know that it's not caused by parenting or anything you did. That's a relief. I was wondering if maybe I missed something growing up. Many adults are only diagnosed later in life, especially if their symptoms weren't obvious or were masked. Would it help if I share some common signs in adults? Yes, definitely. Sure. Some common traits include 1. Engaging differently in social situations like avoiding or feeling uncomfortable with eye contact. Finding it hard to make or keep friends. Prefer to be on your own. Being very honest and transparent, which may make other people misinterpret you as being rude or not interested in them. Finding it hard to understand what others are thinking or feeling. Missing cues within conversations like body language or whose turn it is. Finding it hard to say how you feel, not understanding sarcasm or phrases such as break a leg or taking things literally. 2. Having repeated behavior or urges to move that seem unrelated to what's going on. These may increase if you are stressed, anxious, or excited. 3. Preferring order, rules, and routines and finding it hard to cope with change. 4. Experiencing sensations such as smell, touch, taste, texture, hearing, and pain at a different level to others, either as a higher or lower level. 5. Being able to focus on certain tasks or interests very closely and understand them in great detail. Do any of these sound familiar? Honestly, a lot of them. I always thought I was just weird or too sensitive. You are not too anything. You're learning more about how your brain works, and that's empowering. Would you like to talk about ways to take care of yourself now that you know? Yes, that would help a lot. Great, let's go over a few things together. 1. Knowing your triggers. Keep track of what's overwhelmed you and plan around it. 2. Create routines. Predictable schedules can reduce anxiety. 3. Set boundaries. It's okay to say no to social events or ask for accommodations. 4. Use calming tools like noise-cancelling headphones, weighted blankets, or quiet spaces. 5. Practice self-advocacy by learning how to ask for what you need at work or in relationships. 6. Connect with others. Autism support groups, online or local, can be life-changing. 7. Seek professional support. Therapists who understand autism can help with stress, burnout, or executive function challenges. I really appreciate that. Thank you. You're very welcome. And remember, there's no one right way to be autistic. You get to decide what works for you. That was so helpful. Make sure you follow Selene the Nurse to learn more about your health.